Hello everyone, Hai và Lát đây. Xin chào mọi người. Chào mừng mọi người đã quay trở lại với kênh YouTube của tôi. Và hôm nay mình sẽ làm video sẽ hướng dẫn các chị em khi có trẻ em nhỏ và những cái phản xạ của trẻ em nhỏ mọi người cần phải đều biết để phát hiện sớm, để mình có thể tìm cách điều trị thật nhanh chóng để không gây những cái tổn thương và tác hại sau này mọi người nhé. Cùng mình đón xem. Let's go.
Moro Reflex. Moro reflex is an infantile reflex that is normally present in all newborns or infants. The Moro reflex is normally seen at birth, and it is an involuntary response to stimulation. This reflex is present up to 4 to 5 months of age as a response to a sudden loss of support. The infant feels as if it is falling. This reflex is typically assessed in newborns and in the well baby checkup to see if the reflex is present and if it disappeared as scheduled. The Moro reflex evaluates the integration of the central nervous system. This tells us that the infant's nervous system is developing normally. How does the reflex work? The head is gently lifted with enough support to begin to move the body weight of the infant from the examination table. Support of the infant is then released suddenly, allowing the infant to fall backwards for a moment, but then quickly supported again. The normal response of the infant is to have a startled look. At the reflex ends, the infant draws its arm back to the body and then relaxes. Absence of the Moro reflex in infants is abnormal. If the reflex is absent or abnormal, tests may be needed to examine the child's muscles. These tests may include shoulder x-rays or tests for disorder associated with a brachial plexus injury. Absence in both sides suggests damage to the brain or to the spinal cord. Absence only in one side suggests either a broken shoulder bone or an injury to the brachial plexus. In a child with a shoulder injury, palpation of the shoulder may cause the infant to cry. The infant may have an associated clavicle fracture. Moro reflex involves 3 distinct components. 1. Spreading out of the arms, abduction. 2. Unspreading the arms, adduction. 3. Crying usually. An intact Moro reflex signals that the infant does not have a true brachial plexus injury. Differential diagnosis of brachial plexus injury in newborns. Clavicle fracture with pseudo-paralysis, it is the most common. Proximal humeral epiphyseal separation, and shoulder dislocation. Clavicle fracture with pseudo-paralysis. An isolated clavicle fracture is the most common. Infants with pseudo-paralysis from a fractured clavicle usually have an intact Moro reflex. Most infants recover in 7 to 10 days from the pseudo-paralysis. Patients should be followed up for clavicle fracture and for observation of the pseudo-paralysis. The condition is easily distinguished from a brachial plexus injury because the infant with isolated clavicle fracture will usually have an intact Moro reflex. Clavicle fractures occur in association with a brachial plexus injury in about 10% of patients. Persistence of the Moro reflex beyond 4 to 5 months of age occurs in severe neurological situations. Persistence of Moro reflex beyond 24 months of age indicates a poor prognosis for independent ambulation, especially if the sitting balance is not achieved by 2 years of age. It is believed that as the brain development progresses, the voluntary movements are taking over and this reflex disappears. Thank you very much. I hope that was helpful.
Não bộ nên là không thể nào mà giữ thăng bằng được. Chị em ạ, thì đây là một video ngắn của mình đã đưa ra chia sẻ những cái kinh nghiệm mà mình đã biết về những cái phản xạ của trẻ sơ sinh từ 4 đến 5 tháng tuổi. Mọi người lúc có con nhỏ hãy để ý nhé. Xin cảm ơn mọi người, hẹn gặp lại mọi người video lần sau.